Hey, it's Jessica DaMassa with WTF Health, and joining me right now, I have Glen Tullman, the Executive Chairman and Founder of Livongo. How are you?
I'm great. It's been a great JP Morgan conference, and we're excited about all the new news we have to announce.
All right, so big news is Dexcom. So tell me a little bit about this deal and what exactly this means.
Well, Dexcom, as you know, is the leader in the CGM world, and it's really exciting for us to partner with them because we've had requests from our members to say, how do we connect this great technology with the Livongo platform? And so the ability to put these two companies together in a partnership is really exciting for us.
And I know this was something that the industry was looking at before you guys did your IPO in the S1. This was something that was pointed out as like, a little bit of a question about whether or not you guys were going to be able to figure out how to integrate with a continuous glucose monitor. So this kind of puts those questions to bed, right?
It does. People didn't understand, is Dexcom a competitor or other companies like Abbott a competitor? And really what we said was, no, they're great partners for us. We get more data, and then we also work on the behavioral part because you need great data, and you need it 24/7 if you can get it. And then you also need the behavioral part to say, what do you do with all that data? How do you turn that data into information? And that's what our platform does through all the data science that we're doing. We're able to turn it into usable information for our members, and our members love it.
And as far as supporting the reimbursement for that, I mean, what's going to have to change there? Because is it going to be? I mean, does this take out the is it this or is it that question now that they can be combined together?
Well, it really doesn't. So people who have a CGM will continue to use the CGM. It will be reimbursed the same way it's reimbursed. And from our standpoint, if they have it, great. And if they don't have it, that's okay too. So we're meeting our members where they are. Whatever works best for our members is what we'll do.
The other thing I wanted to ask you about, and this was big news to me because I'm a total nerd when it comes to this stuff, but was Express Scripts and their digital health formulary. And you guys are listed on there. So this is 15 companies that they have cherry picked from the entire world of digital health. They've narrowed it down to 15, and then they rated companies as preferred for different categories. And so Livongo preferred for pre-diabetes, diabetes, and also for heart disease, right? And that you're the only one to get the triple preferred.
We're the only one to get, we're actually
the triple crown from Express Scripts.
The only preferred on the formulary. So there's preferred, and that's what the Express Scripts sales force goes out and sells and says, this is what we would prefer you to use. This is where you're going to get the best results and the best economics. And so we're the only one across 3 categories. Really big, but also they have a new risk product.
Okay.
And on their risk product, we're the exclusive product used in part because the message they're sending is, hey, if it really matters and if it was our money, what would we do? We'd use Livongo. And that's what's really exciting. And last but not least, we're their employees, and they're using Livongo for their employees.
That's awesome.
It's a triple win for us.
No, that's great. No, I'm curious, though, as far as that digital formulary is concerned, I mean, I think this was a big step in terms of okay, wow, has digital health kind of actually turned the corner in terms of being, So weigh in on that. I mean, for the greater part of the industry here, I mean, what does this do in terms of changing what's being brought to the table when it's a company like yours or a digital health company that's now negotiating with a PBM or that has to talk with a health plan and try to figure out how to get this stuff reimbursed in a way that's at parity with what's already out there?
I think there's a few things that happen. One, first, our IPO, the largest consumer-facing digital IPO in history, so really exciting. But that opened the market up, not just for us, because it showed all of the digital health companies out there, and we need many digital health solutions, showed them that you can do an IPO, you can do digital health at scale. And then I think the big PBMs also stepped in and said, listen, we're feeling the demand, we're seeing the results. So whether it be Express Scripts with their digital formulary, whether it be CVS Health and all the work they're doing in digital, 2 really great partners for us, but not just for us, for some of the other players out in the industry. We want a very healthy digital health environment, consumer-facing digital health. Why? Because with the 147 million Americans who have a chronic condition, you can't solve that using our traditional healthcare system. You need a different approach, and that's digital health.
It is. And I think everybody's talking about this being the year of, maybe digital health hitting that inflection point, and that we're also going to see some more exits this year. So, I mean, I know you're also an investor in addition to being the chairman of Livongo and also the founder. So to weigh in from a perspective, I mean, I'd love to hear what your thoughts are. Do you think we're going to see more exits this year? What did you guys start here?
Well, I think what we're going to see is more activity.
Okay.
And whether
Meaning
those
what?
are exits, well, those could be mergers, those could be partnerships, those could be strategic relationships, but it just just a ton of activity, number one. Number two, people are moving towards scale. They're moving toward platforms. So when we talk to our clients, whether they be large self-insured employers, whether they be payers, PBMs, the government, they're all saying what we want is we want one solution for the whole person. We don't want to buy individual piecemeal solutions anymore. So I think we're going to see more platforms start to emerge, and Livongo is the leader in that space. So that's pretty exciting.
I love that you've just claimed that, and we are the leader in that. Well, you kind of are.
Well, now you just said it too, so there we are.
It's contagious. It's contagious. All right, Glenn. Well, thank you so much for dropping by. It's a pleasure, as always, to pick your brain about this stuff.
Great.
I love to hear it. Thank you. I'm Jessica DaMassa with WTF Health. Thanks for joining us.